Okay, so I think it's slowed down. So just in the interest of time, we'll get started. So hello, everyone. My name is Bakun Adebimbo, and I'm the Manager of Operations with the Canadian Breast Cancer Network. So before we get started, I'd like to cover a few housekeeping items. So the session is being recorded and it'll be available on our website for anyone who may have missed it or wants to rewatch it. And the link of the video will be shared via email once it's published on our website. I'd like to extend our sincere appreciation to our sponsors for this event, our gold sponsor, Novartis, silver sponsors, Pfizer and Viatris, and our bronze sponsors, AstraZeneca and Roche. Our question and expert sessions are strictly dedicated to answering your questions, so there will be no presentation from our speaker, and she'll be answering live questions from participants, along with the ones that were submitted in advance. So please use the Q&A button at the bottom or side of your screen to submit your questions, and we'll aim to take as many as possible. I'd like to welcome our host for the session, Kathy Amendeleo, Chair of the Board of the Canadian Breast Cancer Network. Kathy?
Thanks, Bakun. Welcome again, everyone. Thank you for joining us. I'm pleased to welcome Marize Ibrahim, who is joining us to answer all your questions about breast cancer-related lymphedema. Marize is a licensed lymphedema therapist and a certified physiotherapist. She currently works at the McGill University Hospital Center Lymphedema Clinic. She has, in 2020, received the Physiotherapy Specialty Certification. The Board of Canada granted her the designation of Clinical Specialist Oncologist. Marize, thank you for joining us this afternoon. It's wonderful to have you with us today.
Thank you very much. It's a pleasure to be here.
Okay, so we do receive questions beforehand. So while we wait for patients to start submitting their questions, we're going to start with some that I have previously submitted. So one of the questions that was submitted asks, how long after surgery can lymphedema develop? The patient had surgery a few years ago and is now beginning to get some swelling.
Yeah, so it's a very good question. So lymphedema can develop shortly after surgery or completion of radiation, but it is a lifelong risk. So meaning that if a woman has undergone any form of lymph node dissection post-surgery, or if she's had radiotherapy within her lifetime, she's always at risk. But usually if lymphedema develops, it will develop within the first 2 years after completion of treatment. So I'm not sure if that answers your question.
Oh, so you have it quite defined as being a little bit from 0 to 2 years. So if somebody get it afterwards? Because often patients are told to be very careful about injuries to the area into the arm that they've had the surgical intervention, like if they get blood pressure taken, if they get a blood taken from that arm. Normally they're asked not to do that. Is this still the case? Is like an injury, a fall, or something that is an impact injury? Could that cause the swelling from lymphedema to develop even years after?
Yeah, so that's it. So it because it's a lifelong risk, it means that if the woman doesn't develop it within the first 2 years, it doesn't necessarily mean that she will never develop it. It's just more common that we see it develop within the first 2 years after completion of treatment. But there are certain precautions that we do guide our women to take, but lifelong, right? So, just being careful when you're exercising, so progressively returning to exercise slowly. There's certain precautions that we recommend for flying, for example. These are things that we try to encourage our women to just be careful, but it is a lifelong risk. So, we've had cases where, a woman develops it within the first, 6 months after treatment. And we've seen cases where a woman has developed it 18 years after completion of her treatment. And so because it's a lifelong risk, we do encourage our women to just, watch their arms, be mindful of the volume. If they notice any change, to contact their lymphedema therapist. But statistically, it's just a general statement that we do tend to see more patients develop it within the first 2 years of treatment completion.
I have another question to follow that. I'm thinking, is there such, do individuals have any lymphedema? Like, could there be zero or some lymphedema that goes unnoticed? Like, I'm wondering, is it lymphedema free for most people? Or do you have some lymphedema? Do you have some lymphedema after you've had surgical intervention and not have any problem with it or major problem with it?
So there are different actually stages of lymphedema, and there was a question that was submitted earlier that asked that. So there's 4 stages. There's stage 0, stage 1, stage 2, and stage 3. So if you count that, that's actually 4 in total. Now, stage 0 is when there's been actual lymphatic changes, but the patient or the woman is not symptomatic, meaning that there's excuse me, she can be symptomatic, but there's no clinical signs. So she can complain that, you know, her arm feels a bit heavier than the other side, but clinically, when we measure, she doesn't have lymphedema by definition based on just volume circumference. That doesn't necessarily mean she doesn't have the risk of developing lymphedema or that progressing to a stage 1, for example. So there's definitely degrees of lymphedema. Our goal is to always try to catch it when it's minimal, so that we don't get to a stage 3 and we're dealing with a lot more fibrotic tissue, and then it becomes very difficult to manage at that stage. But yes, certainly you can have milder versions, what we refer to as maybe moderate, and then severe cases of lymphedema.
And I don't know if we have this question, but I'm going to ask it anyway. Is lymphedema always measured, or is it by symptom?
Both. So clinically, we take both into account. Yes. So let's say it's a stage 0 and the woman comes in and she keeps complaining that her arms feels very heavy, that it really doesn't feel, you know, right. It doesn't feel like her sound side. And we measure, and there's only, you know, 1% difference. So obviously her arms are almost equal. We don't neglect her symptoms. So we do act accordingly, meaning that if we think she would benefit from using a compression garment, or we would guide her in terms of, you know, what are good exercises that she can do, how to self-manage, you know, how you can measure yourself. These are ways that we try to educate our women to kind of follow. And then if she notices any change from that, obviously, you know, in between follow-ups, then we can bring her back and just reevaluate at that point.
Okay, thank you. I'm going to go on to the next question. Not sure what this means. How likely is irreversible swelling, and how dangerous is this? Is the person asking about an intervention, or?
I think the irreversible swelling, I'm hoping I'm interpreting this right, refers to the lymphedema, because it's by definition, lymphedema is not curable, meaning that there will be always a certain level of swelling, whether it's that mild, moderate, or severe that I referred to earlier. I think that's what this person is trying to ask, if I'm not mistaken.
Okay. This question is on early intervention to prevent permanent damage. The individual is wondering if you know what percentage of cancer treatment centers include an assessment for potential lymphedema early in the process of treatment.
It's a very good question. So I don't have a percentage to give you, because I can't speak on behalf of every single hospital across the country. The general guidelines is that if there's a hospital that has that is a certified oncology center, for example, like the big ones that all of us mainly know, then there should be a lymphedema therapist available if you know, there's patients that need their services. But it is not required that every hospital across the country have a lymphedema therapist. It's mainly just recommended for oncology centers. So unfortunately, I don't have a percentage to answer this particular question.
And another question to that is, what is it a standardized care to inform all patients across our country that the possibility of lymphedema can occur? Or do we have some women who don't even know that lymphedema can happen and are caught off guard?
Correct. So it's our job as healthcare professionals within oncology to try to educate our patients as much as possible. Unfortunately, that's not always the case. So we do, get cases where women they develop lymphedema and they have no idea what this is. And unfortunately, sometimes the healthcare professionals also don't know how to manage it unless you have, the appropriate, certifications and knowledge to manage lymphedema. And so, ideally in a perfect world, we should be, checking all our women post, in a perfect world, it would be before they even do surgery. And then we would monitor them up to 2 years after their completion of treatment. And then that way we can keep a close eye on them. And that will help us manage and catch it early on, which makes it much easier for the woman as opposed to when it becomes a bit more severe. But it is a problem. We do know that this is a national-wide problem, and internationally we have a big issue in terms of just educating more healthcare professionals and eventually, obviously, patients, so that they're not caught off guard, just like you said.
But if you're being seen in an oncology center, I would imagine that the oncologists, the surgeons, every multidisciplinary person who's going to be with you knows about lymphedema. Am I not correct?
They should know, and they do refer when they notice the lymphedema, right? And so, or if the patient complains about it. Sometimes some women are very shy about telling their oncologist certain things, and they might just see a bit of swelling in their arm and think it's normal, not realizing that this is actually lymphedema and this can eventually progress. In the smaller hospitals where there is no oncology center, sometimes those cases can be difficult because, again, they don't have a lymphedema therapist on site, and so they have to refer outside into the private sector. But there is quite a bit of knowledge that we do have to educate our doctors, our nurses, all healthcare professionals, because this is not necessarily a topic that we bring up that often in general.
Okay, good. The next question I have is, it says, I have relatively mild lymphedema that I am able to control with compression garments. What do I need to be mindful of to avoid making it worse? Can you give me some tips on how to control it during situations like air travel or extreme heat? So what tips can you offer in general?
So general tips, it's all about self-management of lymphedema, right? So there are a few pillars that we try to educate our women about. So skincare is one of them. So trying to make sure that your skin remains well hydrated, avoiding any nicks if you can, and if you do get a nick, to just clean it really well. Exercise is a big component. So choosing an activity that you like and just starting slowly, right? And so if you like to do yoga, or if you like to do a Zumba class, that's fantastic. As long as you enjoy the exercise, that's important. And you slowly get into it. You don't want to go from 0% to 100%. You want to slowly get your body moving, because you don't want to shock the lymphatic system either. So it's what we refer to as a slow progressive return to exercise. So that's very important. Weight management is also quite important, and it's very, very challenging for a lot of our women who are on hormone therapy after breast cancer treatment. So managing your weight, trying not to gain an excessive amount, because that can impact the lymphatic system. Compression, obviously, that's very important. So, if you've been prescribed a compression garment, always speak to the lymphedema therapist in terms of when you should be wearing your garment. Some people need it just for a day. Some people need a day garment and a night garment. And so these are things that you would discuss individually with your lymphedema therapist, because every case is different. And for air travel, usually we try to err on the side of caution, meaning that we do try to encourage our women, if they've been prescribed a compression garment, to wear it during their flight. Ideally, you'd put it on before your flight. You'd wear it during the duration of the full flight. And then depending on where you land, usually we say, okay, keep it on for the remainder of the day, and then remove it at the end of the day before you sleep, just because of that change in pressure, depending on what country you go to. Some have a higher sea level than others, so you just want your lymphatic system to kind of level off a little bit after your flight. And so these are things that we would try to educate our women about. But really the big ones are everything that I've just said, and just, watching and monitoring all that self-management by looking at your skin every day, making sure there's no abrasions, things like that.
Great, thank you. Bakun, let's take some questions from our live audience now.
For sure. So kind of following up on the using compression sleeves when flying. So if someone uses a compression sleeve solely for flying, so they want to know how often they should replace it.
That's a good question. I mean, it depends on how many flights you take, right? So if you're someone who's a businesswoman and you're flying once or twice a week, right, versus someone who's maybe using it, taking a flight twice a year. So I think it depends on the frequency of how often you're flying. I would say, if you're a frequent flyer and you're using it, often enough, then yeah, it's worth maybe changing every 6 months or so. But if you're not flying that often, then maybe once a year is enough for that person.
Perfect. Yeah, we seem to have a few on flying actually. Someone wants to know, so if they're flying overnight, should they wear a day or a night compression garment?
That's a very good question. So, I think it depend on the patient. So if the patient is used to wearing their night garment at night and it is an overnight flight, they can certainly keep with that sort of schedule. If they are not sleeping on the airplane and, the overnight flight becomes quickly, you change time zones and all of a sudden the sun comes out after 2-3 hours and they can tolerate their day sleeve, then they can certainly wear their day sleeve. And so it would really depend on the patient comfort as well. So there's no black or white with these answers. It really depends on the patient and the individual case.
Perfect. I'll ask one more on flying and then we'll go back to Kathy with the pre-submitted questions. So someone wants to know how soon is flying or how safe is flying right after surgery. So they recently had surgery and they're hoping to fly 10 weeks after their surgery. And when their radiation is complete, is that a good enough time to wait? Should they be waiting longer or does it really matter?
I mean, if there's something urgent, you need to fly out in 10 weeks after radiation, that's okay. Just speak to your lymphedema therapist, just to make sure that, if you do have lymphedema, we try to get the patient the garment as soon as possible so that we're not delayed. But there's no contraindication to flying. I think it's just making sure that medically the person is stable as well, so that they're feeling okay post chemo, they're recovering from surgery, they've recovered from radiotherapy, and that there isn't anything pressing medically before they go on that flight. So yeah, there's really no contraindication as long as all your, everything's checked off and they're okay, they're feeling good.
Perfect. Kathy?
Yeah, so I'm just going to keep to this. What are the differences between the two, the day and the night sleeves?
Good question. So the day garments are a little bit more snug, and they're actually designed for muscle movement, right? Because during the day, we're constantly moving our arms, we're, depending on our job, depending on what we're doing. And so the compression is slightly tighter. The night garments are a little bit looser and they're a bit more cushiony with their fabric, again, depending on the garment that's used, but they're not as tight, because we know that at night you're not using your muscles, right? The muscles are pretty relaxed. And so you don't need that exact same amount of compression as you would during the day.
Okay.
So that's why we don't encourage our women typically to wear their day garment at night, because, we come across problems where there's, calluses that are formed, and it's not designed for a muscle that's resting.
And another question comes to mind. How much is too much time to wear a compression garment?
So some patients unfortunately need to be in compression 23/24 hours, meaning that, we tell them to remove it for 1 hour when they need to shower, etc. But again, the 23/24 hours doesn't mean that they're in a day garment for 23 hours, right? And so that's where we have to play around with using it during their waking hours during the day and then transitioning into their night garment. Some of our women, they love their night garment, so they prefer to kind of start wearing that from 7 p.m. at night, and that's okay. So you work with the individual woman and just to see what they're willing to do and what they're willing to try.
Okay, great. So I'm going to go and continue with the pre-submitted questions. This question, The person writes, I find compression garments do not work well to keep the swelling down. What kind of exercises can I do to control swelling and build up strength in the arm? And are there limits to how much exercises and types of exercises to do?
So that for that particular case, I would say you'd have to go back and try different garments, because there's many different companies out there. Some companies work, I would say better for certain cases than others. If the garment doesn't fit well, that means that we have to try a different garment or a different company, right? So it could be that the fitting is not well. It could be too tight around the wrist, blocking the flow in that area. So I would take a step back and say, not to necessarily generalize and say garments don't work for me, but say, okay, maybe this particular garment isn't working for me. What are my other options? And that's where, talking to your lymphedema therapist is important, because, they can show you and walk you through what garment options you can try first. The second part of the question, in terms of exercise, like I mentioned before, there's no contraindication to exercise as long as you slowly progress into it. So you don't want to, start with doing a little bit of weights with, 2-3 pounds, and then the next day you're progressing to 20 pounds. That's a big jump for the lymphatic system. But just in general, even for a healthy person, I wouldn't say start with 2-3 pounds and then jump to 20 the next day, right? We need to slowly build on that muscle strength, and that takes a bit of time. And so an example I always give my patients is, the Olympics. Olympic athletes don't wake up one morning and say, I'm going to go to the Olympics tomorrow, right? They spend hours and hours practicing. They progressively train every single day. So it's the same concept, right? There's no contraindication as long as you do it slowly and enjoy it. Pick an exercise that you like and do. If you don't like to swim, please don't swim. If you enjoy walking, go for it. Compliance is really about finding something that you enjoy and doing it, because exercise shouldn't be such a burden. You should actually enjoy it.
Well, that's true. That's true. So this next question, what shavers do you advise women to get for shaving their armpits? I was told never to use a razor for fear of nicks and cuts. I have a 1980 lady shave. It works, but I fear it's on its last leg, and new electric razors look dangerous to me. Please advise. I guess when you're used to doing something and it's worked for you all this time, there is that idea of like, oh my goodness, if I change this, something will happen. I can understand.
Sure. That's a very good question. I'm not an expert with all the different razor companies, so I'm going to start by answering it that way. Years ago, a dermatologist joked, and she said to me once, there's nothing wrong for a woman to use a male razor. And she actually gave me a reason why, which I thought was very nice. Male razors there's more of them and they're sharper. And so because they're sharper, they cut cleaner. And ever since then, I admittedly use a male razor to shave. I have no problem saying that out loud. But because it gives a cleaner cut, you're less likely to kind of have too much abrasion. Now, with that said, does it mean that you're not going to be mindful, right? And so you always want to take something clean, make sure that there's no, bacteria sitting there. If it's been sitting there for a while, please don't use it. And if it belongs to your partner, please don't use it. So just start with something very clean, cut very slowly, just shave very gently, and just monitor to make sure that you don't cut yourself. So that would probably be maybe just a simple tip that I would advise. But if you're looking more for specific companies, I don't think I'm the right person for that, unfortunately.
And unfortunately, there is no company out there that decided that they're going to say, look, use this razor for lymphedema. They can do everything, but this has not come along our radar yet.
No, not that I'm aware of.
and to stick to this like removal of hairs thing, what about women who what do you call it? They oh God, not shave, but sorry?
Waxing?
Yes, waxing. I just had a blank there. That's safe, right?
So the waxing can probably be a little bit more aggressive on the skin, especially if it's I mean, we're talking within the lymphedema arm or armpit, right? We're not talking about if you wanted to try it elsewhere on the body. I would say probably start a bit gentle, maybe with a nice clean razor. But that can depend. Some women can have a a reaction to that, particularly to their skin. So if it's not something you've done in the past, maybe it's not something you'd want to try new. And to test it, I would test it a small piece on your sound arm, right? Just to kind of get a feel with how your skin is going to react. Depending on the type of wax, there's some chemicals that maybe don't correspond very well to people's skin. So if you're going to do a trial, don't do a trial right on the lymphedema arm. That would be my educated guess there.
Oh, we covered the removal of the hair. That's great. So do massages actually work? How often should you see a registered therapist for manual drainage?
So we get this question a lot. So manual lymphatic drainage is considered one of the pillars for lymphedema management. Now, usually it's most advisable when we are in the intensive phase, which refers to when we're trying to reduce the arm volume. But manual lymphatic drainage should be combined with bandaging. So if the woman has, a big difference between her affected and her unaffected arm, and she sees a therapist and the therapist does manual lymphatic drainage, that should be done in conjunction with bandaging. Because if you drain the fluid, but if you don't contain it, then we're sort of back to square one, right? So it's a two-step process. You can certainly do self massage, every morning or in the evening. But definitely just combining that with exercise is important. So we try not to get our women to do it alone. We try to get them to do it in combination with another pillar. So whether that's bandaging, whether that's exercise, because we know that it's more effective when it's combined with the other pillars.
Great, thanks. So Bakun, let's take some more live questions now.
Sure. So this one is also related to the last question. So in terms of I guess like getting rid of the swelling. Do you know, like, is there any research-based or evidence-based research or statistics that talk about which is the more proven or effective type of therapy? Like, is one better than the other, or is it, like you said, it's more about combining a few of those pillars, like that's what's more effective?
It really is a combination, because just like managing breast cancer, it's not just necessarily one treatment. Unfortunately, women might have to do chemo, radiation, surgery, and so it's sort of the similar concept. You want to treat it the best you can. So, in terms of priority, I would say, start with your skin management. Make sure your skin is pristine. Using compression if it's advised, trying to do a little bit of exercise every day. That the weight management is very important. And so all of these in combination, should be done sort of simultaneously, just to make sure that the lymphedema is managed correctly. So there's no research article that's going to say, one is more, superior than the other. It's really a combination of everything.
Perfect. This one's on a different path. Someone's asking, is it unwise to go into hot tubs when you have lymphedema?
Yes, so we get that question quite a bit, actually. You don't want to overheat the lymphatic system. So, for example, when during the summer, especially if it's humid, depending on where you live, managing lymphedema in the heat can be very difficult, because it's not always comfortable to wear a garment in the summer. Let's be honest. But also heat tends to cause the lymphatic system to work harder. And so women tend to feel a bit more bloated or swollen in the summer. And so if you expose the lymphatic system to like very hot sauna, for example, ideally it's not, you don't want to do that, because then you're just provoking more pressure on the lymphatic system, which is already compromised for that woman, right? So if it's a normal temperature pool, that's more advisable, as opposed to something that's very hot.
Perfect. And then just going back to the idea of combining therapies. So you've talked about exercising and compression sleeves. So would you use both of them at the same time? Like if you're doing light exercise, would you do that while wearing a compression sleeve? Or if you were swimming, doing aquafit classes, like would you be wearing the sleeve as you're doing the exercise? Or is it one after the other?
Good question. Good question. So I'm going to answer that in two separate ways. So when you're doing exercise outside the water and you were prescribed a compression sleeve, and the lymphedema therapist insists that you wear it. So yes, we do encourage our women to wear it when they're exercising. The water is a different story. because the water is a natural compression. So that's when we allow patients to kind of cheat a little bit so they can remove their compression garment and they can do a little bit of swimming. They can do an aquafit class. We do have specific, exercises that can be done in the water to help encourage the lymphatic system to be stimulated more, but it will be because of the natural compression from the water. So you do not need to wear it in the water, but yes, if you do have a compression garment, we do encourage you to wear it when you're exercising outside the water.
Perfect. Back to you, Kathy.
So before I go back to the pre-submitted questions, I have a question around research funding, and do we have anything that is currently moving away from us having to talk about this, where we can actually have something that is curative perhaps, or benefit a lot better than what we're currently doing with lymphedema?
Yes, that's always the $1 million question, isn't it? So there's experimental surgeries that are being done actually all over the world, some a bit more successful than others. And we do have a few surgeons actually in Canada that are also performing some surgeries. Now, the surgeries don't guarantee that you'll be cured of your lymphedema. And I think that's one thing that's very important to remember. And they're only done once the patient has exhausted their conservative treatment. So they've tried everything, all avenues, they've tried the compression, they've done everything that I've just mentioned previously. You can go to a surgeon, obviously ones that are trained to do so, and there are specific criteria in order to be eligible to do a lymphatic surgery. But again, if it's done, it doesn't necessarily mean that you do not wear your garment after. And so this is where there's sometimes a bit of confusion, because patients think, okay, I'm going to do my lymphedema surgery and I never have to wear my garment again. And so unfortunately, that's not the case. I mean, there's a lot of research that's being done on the different types of surgeries. There's a few medications that have been trialed previously, but to date, nothing has been proven successful to completely cure lymphedema. And so this is what makes this condition chronic, because we don't have an answer yet to trying to get rid of this fluid permanently.
Okay, thank you. So I'm going to jump onto the pre-submitted questions. What could be a reason for sudden exacerbation of swelling in a previously stable arm?
Yes, so that's a very good question. Usually in the oncology world, we unfortunately do have to think of a recurrence. And so sometimes if there is a risk of recurrence, we have to be mindful of that. And we would, the lymphedema therapist would work with the doctor and, just make sure that all the images were done to rule out if there's a cancer recurrence. Other things that can trigger the lymphedema from worsening suddenly could be triggers. So for example, if there was a cellulitis or a skin infection, so with every skin infection or cellulitis that happens, that further damages the lymphatic vessels. And so that can be contributing to the lymphedema worsening. And then other triggers. So let's say it's in the middle of the summer and you get a pretty wicked mosquito bite and that turns into an infection. Again, that could be another trigger that could worsen. And so we have to look at the history, we have to listen, we have to hear the patient, we have to actively, brainstorm in terms of what has happened that can lead to this trigger of worsening lymphedema.
Okay. Next question. Who is qualified to surgically fix/release a trigger finger on the same arm that nodes were removed? Trigger finger is a rare side effect of letrozole use.
Good question. So trigger fingers are done usually by plastic surgeons. And so it would be a plastic surgeon that would be able to treat that. And you would, the patient would have to just advise the surgeon that, there is also lymphedema on that arm. But if it's a pretty severe trigger finger, then definitely would be the plastic surgeon to address that.
Okay. And the next question is, can you have lymphedema in areas other than your limbs or chest, such as your side or armpit?
Yeah, so if there's, let's say it's the right arm that's affected, so lymphedema can can sometimes appear under the armpit, or what we call the lateral chest, so the side of the trunk. Even within the breast, we can see lymphedema. So it's usually on the pathway of the lymphatic system. And so anatomically, we know that certain areas drain into certain sites. And so if that part of the lymphatic system was compromised, it will affect all the area that it drains into. And so, yes, the answer is you can. You don't, however, get lymphedema, let's say on the right arm, and then all of a sudden you wake up with your left leg swollen with lymphedema. That's usually not how it works.
Okay. Bakun?
Yeah, so previously you had said that someone can do self massages every day. Is this the same? Like, would it be that often as well if you were doing it with like a professional? Is there a difference between the two?
I mean, the professional has the knowledge to do the complete manual lymphatic drainage, but I would say, you know, if the manual lymphatic drainage is when the woman is doing it herself, or the self manual lymphatic drainage, if she feels that it's a big burden for her to do it every single day, she doesn't have to. She can just she can do some exercise instead, right? So it's really there in case, you know, the woman doesn't have time to be able to do a little bit of movement or go for that walk or participate in her Zumba class. It's not necessarily something that has to be done on a daily basis. Some women like it because it helps to relax them, and you know, it just gives them something to help remove the lymphatic fluid. But they shouldn't feel guilty if they can't do it every day. I mean, you know, I'm sure they have a lot of other things on their plate to manage, whether their kids or their family or return to work, or, you know, I can name quite a few. So they shouldn't feel guilty if they can't get to it daily.
Perfect. And so you'd also mentioned like these pillars. So what are the pillars?
So the pillars I mentioned before. So the first one is skincare. Number 2 is compression. Number 3 is exercise. Number 4 is just self-management in general. And then the 5th one is manual lymphatic drainage. So we put all of those together as the 5 major pillars of lymphedema management.
Perfect. And this one is asking about nutrition. Is there any specific foods that someone with lymphedema should eat or avoid?
So we don't have any evidence that certain diets are more superior than others. We do know that excess weight can put more of a strain on the lymphatic system. But unfortunately, to date, we don't have any proven research studies saying that, you know, this particular diet works better than another diet. And so, you know, learning how to cook, learning how to eat healthy is very important. And so speaking and working with a dietitian is important. And if that's something that, you know, the woman needs help with, it's okay to ask for professional advice on that. But unfortunately, we don't have to date a particular diet that will work for lymphedema patients.
Mm-hmm. And then last one here. So this is going back to the hair removal. So they're wondering about electrolysis or laser. Do you have any ideas or opinions on those?
Yes, those are also good questions. Both of them can cause a little bit of inflammation actually on the dermis or on the skin. And so again, if it's not something that was done in the past, and if it's something that the woman wants to explore, I wouldn't try it on the affected limb. So I would do a very small patch to see how her skin responds before she entertains doing it on the affected arm, because you don't want to create too much inflammation, even if it's acute, on the affected area.
Great. Kathy, back to you.
Okay, thanks, Bakun. So my next question, all of the recommended decongestive drainage exercise that I've tried, that I've found so far are for women with lymphedema in their arm. What kind of exercises can I do to help reduce swelling for lymphedema that is only in my breast?
So there is a pathway actually that can be done using manual lymphatic drainage for the breast. So that's something that your lymphedema therapist can actually walk you through. But I would say more importantly, compression is important for the breast lymphedema. So you can get compression by having a swell spot. And so a swell spot is like a big pillow that you can place on the breast. And typically women use that at night because it's just easy to kind of put in a camisole that has already like a built-in bra. And that compression really makes a big difference for breast edema. And then during the day, wearing a compression brassiere. So some women, they find a nice sports bra that works beautifully for them. And so adding that compression during the day should actually manage their breast lymphedema very well. Again, speak to your lymphedema therapist because it's important for them to kind of, do the evaluation and then guide you appropriately to see what has been done. Because there's always little tricks that we can kind of do, whether it's making a small pad for a woman, if you don't want a full swell spot, there's little tricks that we can do to kind of help depending on which area of the breast is swollen. So I would go back and speak to your lymphedema therapist for that for more detail.
The next question, is it normal for your armpit to have pain, go numb, and stay hard for a long time? I had a doctor tell me lymphedema doesn't cause pain, but my arm does with any overuse.
So it's true that lymphedema by definition shouldn't be painful. Some women feel that it's painful because of the heaviness. So they report it's painful because of that heavy sensation. If there's pain in the shoulder or in the armpit, then my head says, okay, well, let's look at the shoulder and let's see if there's something else that we're missing. So something like an axillary web syndrome, which is a common side effect that we tend to see after surgery and radiation. Sometimes it's the cord that's giving the woman the pain, not the lymphedema. Or sometimes it's just, all the procedures that the woman has had, it's left the shoulder traumatized, right? And so it goes back to, doing rehab to recover the shoulder mobility, the strength. And so getting that recovered can actually make a big difference on the pain as well. So I would look beyond just the lymphedema if there is pain in the shoulder.
Yeah. And I guess numbness can happen after you've had, especially if you had so many lymph nodes taken out. So that causes a difference in your lymphatic drainage when there's all those nodes that have been surgically removed, or maybe even a small amount of nodes.
So the numbness actually tends to come more from the surgery. And so because the nerves have been cut through surgery, so the sensation never quite returns back to normal. For some women it does, but for others it doesn't, unfortunately. Numbness, it depends on where the numbness is, right? So if it's in both your fingers, then I would look even higher and maybe evaluate the neck, because sometimes a disc problem can create numbness in both your fingers, right? And so the word numbness can be coming from different things, not necessarily because the lymphatic system was impacted. But that's why, a therapist who kind of has a physio hat as well is good, because they're trained to kind of pick up on different, what we call musculoskeletal conditions that can also impact, whether it's the shoulder or the cervical spine, the neck, leading to numbness.
Okay. So the next question, I'm struggling to figure out what triggers my arm to be more swollen. I get massages monthly, swim regularly, wear a compression sleeve all day, and I brush my arm and chest every morning. I don't know what that means. Maybe you'll explain it to us. Is there anything else I can do, or are there things I should be doing, I guess it says.
Should not be doing.
Things
Maybe
I
there's
should
something that they
avoid.
are doing.
I
Yeah.
should avoid that may be triggering it. Sorry, I missed that.
No.
Okay. So I think this question was sort of asked in a different way earlier, but the first thing I would do is to actually just check the compression. So is the compression maybe too tight or restricting the vessels? Was it measured correctly? Was it fitted well? Is it too old? Did this woman gain a little bit of weight affecting her lymphedema, therefore affecting the garment? So that would be the first thing to look at. What's happening with the garment, right? And then once we sort of fix that problem, then we can address other things. There's no research study that says one exercise is more superior than the other when it comes to lymphedema management. So choosing an exercise that the individual likes is important. But before doing any of that, I would say go back to your lymphedema therapist and get that garment checked out, because half the time it's just it's the fitting of the garment, or maybe the compression class is not strong enough to contain the volume. And then we can, they can play around with what needs to be done and trial and error until you get the perfect fit. It's very rare to get one garment and it'll be perfect right from the get-go. We try our best, but everybody's different, everyone's anatomy is different. And so we have educated guesses in terms of what compression garment will work for certain patients. But it is, after all, a trial and error until you find that sweet garment that you like.
Okay, and so as we're speaking about, I wanted to ask these couple questions around access. So are individuals able to access these free of cost, the therapy sessions? Do all individuals get access to a lymphedema specialist or a clinic? And the garments, what about the garments? Are those also, can they use their insurance? Is it off Medicare? Speak to us a little bit around that.
So, unfortunately in Canada, we almost have like 10 different healthcare systems because every province works very differently. Now, majority of the provinces will have some form of coverage. I'm practicing in Quebec, so I can speak a bit more in depth about Quebec. So for example, our patients, all our oncology lymphedema patients are entitled to 3 garments per limb per year, day garments, and they're eligible for 1 night garment. And sometimes there's little codes of exception that we can kind of work around in order to get them, like, let's say, a Velcro device or anything extra. However, every province is not like that, unfortunately. And so we do have a summary in terms of which provinces cover what, but it's not all the same. And so you would have to go back. So let's say you're a patient in Ontario, you'd have to go back to your Ontario healthcare system and look at the Lymphedema Association of Ontario and see, okay, what does the government cover for me? And then likewise in British Columbia, depending on what province, but the government should cover a good portion. So for example, in Quebec, they cover the garment up to 75% of the cost, but this is not necessarily true, let's say, in another province. And so I don't want to make a general statement saying that the government will cover your garment across the entire country, because I know for a fact that every province works, unfortunately, slightly different.
What about access to therapy?
And that's another challenge. So access to therapy is a challenge, for lack of a better word. If you're in a hospital, in an oncology center that has a lymphedema therapist in the public sector, then you can access the therapist free of charge. Unfortunately, a lot of hospitals may not have a lymphedema therapist, and so a lot of patients end up going into the private sector. And so making sure that the therapist that you see is properly trained. The best way to do that is to actually go back to the Lymphedema Association of the province, and each province should have a list of the therapists that are trained. And then that way, that when you're going to encounter, so-and-so, that they do have the proper knowledge to be able to help you. But unfortunately, we don't have enough services in the public sector for all our patients. And so some have to straddle both public and private sectors. If you do have private insurance, of course, that's fantastic, and that will help with some of the treatments that is required. But unfortunately, a lot of our patients may not necessarily have that. And so if you do have access to, a therapist in the public sector, fantastic. Definitely try to get a referral there.
Okay. Bakun, let's take some questions from the live audience.
Sure. So this person says they had their surgery last November, and they're on a waiting list to be seen at the clinic. But what can they do in the meantime to manage the discomfort in their arms? I guess they haven't been diagnosed with lymphedema or anything like that, but they're feeling some type of discomfort. So can they still use those 5 pillars, or is that specifically for when you've been diagnosed?
So first step is to actually get the diagnosis. So it's important that the doctor says, okay, you do have lymphedema in your right or left arm, whatever arm it is. That's the first step. And then the second step is if this particular person has private insurance, maybe it's worth booking one consult with a lymphedema therapist in the private sector until they wait to be seen in the public sector, for example. The compression garment cannot be purchased without the doctor's signature. And so, you know, you can't just walk into the pharmacy, or you can't just walk into the medical stores and say, I want a compression sleeve. They cannot give it to you. So you need a prescription for that. But the other pillars you can certainly work on, right? And so, you know, skincare, you can definitely work on that. Exercise, so trying to get your range of motion going. If it's a bit restricted, you know, you can see a physiotherapist to try to get your mobility back. Finding an exercise that you like to do. So whether it's the yoga class or joining the gym again. And so these are things that you can do until you see your lymphedema therapist. So those are all things absolutely that you can work on until you can get your consult.
Perfect. This is about pneumatic pumps. Do you recommend those for home use?
Typically we don't. They tend to be pushed a little bit more in other countries, but in Canada, we don't recommend the pneumatic pump. I much prefer that a patient goes for a walk for that half an hour, because actively you're going to gain a lot more from that half an hour walk than you will passively through a pneumatic pump. And so because this is a chronic condition, pneumatic pumps are not covered and they can be very expensive. I joke and say, you know, a walk is free and a pneumatic pump is very expensive. So it's much cheaper to go for a walk.
Good answer. Back to you, Kathy.
Sure. So next question. I've had a bilateral mastectomy with 14 lymph nodes removed. What are the steps to diagnose lymphedema? Is it always associated with swelling? I think we covered this a little bit, but if you can just give them a little bit of step-by-step.
Sure. So the lymphedema diagnosis does indeed have to be confirmed by the doctor. Now, lymphedema therapists, you know, with the training and a bit of expertise, we've become pretty good at diagnosing the lymphedema, but unfortunately, we cannot give that final confirmation. And so that still has to come back from the physician. There are other medical conditions that can also cause swelling, right? And so that's why the medical doctor is important, because they need to rule out to make sure that there isn't anything else medically that we're missing. And so once you get that diagnosis, then you can work closely with your lymphedema therapist to see, okay, what stage are we in? Are we talking about a stage 0 where you've got some symptoms, but clinically there's no sign of lymphedema? Have we entered now into a stage 1 where there's, you know, visible change? It's reversible in this stage. Do you need just a light compression garment? Or have we entered into a stage 2 or 3 where we require a little bit more, you know, aggressive management in terms of trying to reduce the volume before we get you into a compression garment? So it really depends on the stage as well of where you're at.
Okay. So the next question, we talked a little bit about this, but it specifically asks, why does the swelling occur and how dangerous is it? Like, is there a danger? Like, what is the extreme danger to this?
So how it occurs is, in the oncology setting, it's twofold. It's one, during the surgery, often the lymph nodes are removed because that's the first area where cancer cells can spread. And so just, you know, to make sure that the woman survives everything, they take a few lymph nodes, they remove it, they make sure that there's no cancer in there. And so by actually removing part of the lymphatic system, you've already damaged that area. And then the second treatment that also increases the risk of developing lymphedema is the radiotherapy. And so the radiotherapy exposure, whatever healthy lymph nodes remain, they become irradiated. And so they're not pumping as well as the sound side because of that radiation exposure. And so it's really the combination of the two that we know now that causes this accumulation in lymphatic fluid. The lymphatic system in general picks up it transports quite a bit of fluid every day. So if the body transports around 20 liters of fluid, 3 to 4 of that is picked up by the lymphatic system. And so you can appreciate if part of that lymphatic system is impaired, therefore it's not draining properly in that affected area. The second question, sorry, Kathy, could you just remind me, it was...
So the second question was around the danger of
the danger. Thank you.
Yeah, I guess extreme lymphedema, because there are, you know, different types of lymphedema, right?
The different stages, exactly. So I mean, it doesn't shorten your life expectancy, right? So that, if that answers it quickly. However, if the lymphedema sort of gets a bit out of control, it can impact quite a bit the quality of life of the person, right? And so, if we're talking about a stage 3 and the volume difference is, 150% bigger than the unaffected arm, you can appreciate how that would be a very big limb. And that would be difficult. That would be difficult to move. That would be difficult to cook with, to work with. And so it can impact the quality of life of the patient. And that's what we're trying to minimize and improve ultimately, right? So after the completion of breast cancer treatment, we want our women to go back to their normal baseline. And so that involves going back to work, going back to playing with their kids, going back to being, full-time mothers and all of these things. And so it won't shorten your life expectancy, but it can drastically impact the quality of life.
So I have one little additional question regarding drinking fluids. Does that help?
Yes. So drinking fluids, as in, I'm going to say water. I wouldn't
Yes,
necessarily
let's say
say drinking
water.
Coke as fluid, but yes, hydrating yourself is great because that internally hydrates. So a lot of people think that, let's say having very dry skin is just because you don't put enough cream. That's actually not necessarily true. It's also internal hydration. So drinking water is fantastic. You don't have to go and drink 6 liters every day necessarily. I think that's a bit overkill, but, drinking water is certainly a good thing in general. And not just for the lymphatic system, but for your other
But for
organs too.
But,
Yeah.
we often hear drink, and sometimes they say, well, it doesn't really matter, but you're right. I mean, any amount of fluids can certainly help, right?
Definitely. Yeah.
Bakun, I'm going to go send it back to you for live questions.
For sure. So someone's asking again on the pillars. So they're wondering if these pillars are the same for different types of lymphedema. So I know we're focusing a lot on like lymphedema in the arm, but would these pillars be the same for like lymphedema in the breast or like other areas?
Yes. So breast cancer is one cancer that can lead to breast cancer related lymphedema, but we do see lymphedema developing with other tumor sites. And so the pillars are the same, except the obviously the compression will be a little bit different, meaning that, an arm sleeve is an arm sleeve versus a leg garment is a leg garment, right? And so there's smaller nuances in terms of where the lymphedema is, but the pillars generally stay the same. That is correct.
Perfect. Someone's asking about dry brushing. Can you speak more about that?
So I think that was a bit of a maybe fad or something in social media that they came out and said that the dry brushing is great for the lymphatic system. I mean, we don't have any, research studies proving that. For me, it's sort of equivalent to self massage, right? And so if you're able to do the self massage and you wanted to do it with the dry brushing, I mean, if you like it and you enjoy it, go for it, as long as you're not putting too much pressure through it. But we don't have enough scientific research to tell you if it's superior than something else.
Can you explain what dry brushing is before Bakun continues?
Yeah.
So it's like a little brush. I'm not an expert in this, but you can purchase this, I'm sure, in a bunch of different places.
Yeah.
And you basically you can go within the same pathway as the manual lymphatic drainage. That would be ideal because then you're following the pathway. But it's just it's a little brush essentially that is purchased and used to just caress over the lymphatic system or the skin.
Kathy, I don't know if you've ever seen those brushes that like you use in the shower. They have like that long back and you can like scrub it around. So it's like that, but you use it instead of like adding soap or having it wet. You just use it like right on your skin. Yeah.
Okay, good. Well, some people may not have heard about this. So
yeah,
for
sure.
It's a good thing to dig deeper a little bit into this.
Yeah.
Go ahead, Bakun, ask some more questions.
So this person wants to know if there's any updates on a robotic sleeve that was developed in Canada. So I guess it's for compression, but it was like a robotic version. I don't know if you've heard about it, but they want to know if there's any update on it.
Sorry, a robotic sleeve in terms of compression or in terms of?
Yeah, it's a robotic sleeve for lymphedema treatment. It has a microfluidic chip that inflates and deflates balloons in a sleeve to promote fluid flow in the lymphatic system.
So I'm not aware of anything to date. I mean, it sounds sort of like, it depends on how this is moving. It sounds similar to a pump. Like I said, moving your arms every day, just stretching daily is completely free, versus some of these devices that, long term, you're not really sure if they're more superior than just exercise, right? So I always say go with the cheaper option and, start with that, and then we can explore other options. But to date, I haven't heard of anything like this.
Sounds good. Okay, back to you, Kathy.
Sure. Next question. This question is on surgical treatment. Can you explain lymph node transplants? Is this a possible treatment available in Canada? Is this what you were describing when you were addressing, research and up-to-date interventions?
Correct. That's right, Kathy. So there's different forms actually of lymphatic surgeries. I'm just going to address this one in particular. So lymph node transfer basically means that you take healthy lymph nodes. So let's say, the right side is affected. You take lymph nodes from right supraclavicular or right axilla under the armpit, and then they transplant that into the affected armpit. So that would be the right arm, for example. And so the goal is, or the hope is, that when you transplant healthy lymphatic lymph nodes from one area to another, that they will start to improve the lymphatic circulation. Unfortunately, it doesn't necessarily eliminate the fact of the donor site developing lymphedema. And so this is where we have to be careful in terms of where are they getting their lymph nodes. So some studies say that if you take it from the omentum, which is a big area in the belly, the risk of developing donor site is less compared to if you take it from a limb, for example. So if you take it from your good arm or your good leg, because the last thing we want is for the good side to start developing lymphedema. And so again, you need to have a very specialized, clinical evaluation to see if you're eligible for this type of surgery. And again, it doesn't eliminate the fact that the patient still has to use compression garments after. And so that's really an important point to take home.
I have a quick question around this. If somebody is a candidate to have this surgical intervention, these transplants, does the oncologist and the oncology team need to know about this? Is this in collaboration with the surgeon, or how does it work? That you just stem off and do it on your own, or is the team working together?
Yes. So first, the conservative treatment has to be done in order to make sure that they've maximized everything that can be possibly done non-surgically. So all of the pillars that I just discussed. And then once all of that is done, and the patient still wants and insists on exploring the surgery option, at that point, then we make the referral to very specific plastic surgeons, because it's not all plastic surgeons that are trained for this. It's a microscopic surgery, and so you need to have the skills to be able to do this. There are a few surgeons in Canada that are starting to perform this. There's a lot more in the United States, but going to the United States would cost quite a bit of money for a Canadian. So I would say maybe just start with, the surgeons within Canada first. If this is something that you want to explore, do the evaluation, see if you're a candidate first before you entertain the further of surgery or not. But it is a step-by-step process. It's not something that we would encourage women to just, do without proper medical assessment.
And speaking of the United States, is that done on a standardized basis in the United States, or is it the same as here in Canada? Because I know somebody might be listening and say, well, then I'll go to the States, but it's not always the case. If something is standardized and has been developed, we certainly would have, been on the same track.
It shouldn't be done, without the proper steps, right?
Yeah.
So going through, has the conservative treatment been done? Have you been seen by a plastic surgeon? We looked at the lymphatic vessels? Are they viable? Are you a good candidate, right? And so all of these steps should be done before entertaining the surgery. But if all these steps are skipped, I would be concerned. So it's not something that I would advise.
Right, right. Bakun, let's take some live questions.
Sure. So this is on resources. So they're wondering if they can find any specific resources on lymphedema prevention that's specific to breast cancer. So do you know of any resources, or even just in general, like where can people go to find more information about what we're talking about today?
That's a good question. So I tend to use the word risk reduction as opposed to prevention, because I'm not really sure we can ever prevent anything from happening. So risk reduction strategies, every lymphedema association across the country should have their individual website. So if you're living in Quebec, I would encourage you to go to the Quebec. If you're living in Ontario, etc., and going through the proper channels to make sure that your source of information is accurate as well. You don't want to be getting this just from some random Google website. You want to make sure that the information source is valid, Breast Cancer Network, etc. So that would be the first start. And then the second would be to contact a lymphedema therapist. And so find someone in your area, get them to measure your arms, go through the assessment, just trying to see if there is lymphedema or not. And if you do, might possibly need a compression sleeve. And so going through all of that step by step is I would say the safest way.
Perfect. So this person says, I feel tightness in the upper arm only after exercising, and that usually goes away after a day. Is this a normal reaction? Is this related to lymphedema? Like, what could be going on?
So tightness is one thing and pain is something else, right? And so if the muscles have been worked, then yeah, it could be that the muscles are just a little bit sore. And if it goes away quickly, that's not something that we're too concerned about. But if this tightness lingers and it becomes painful and the volume suddenly increases, then that's when we become more concerned. So unless you see any of those, I wouldn't be too worried.
Perfect. So this one is about blood work and blood pressure. So should we be avoiding blood work and taking blood pressure on arms where lymph nodes were moved? And if so, what would you do if the nodes were removed on both sides?
So some patients actually take blood pressure from their ankle. So that is a possibility. So ideally, if it's just one side that's affected, you would want to take the blood pressure from your unaffected limb. And in those rare cases where we have the bilateral, then yes. If it's a life-threatening situation and medically, they need to do it to save your life, then please let them do it to save your life, because we're talking about just, regular blood pressure versus a medical emergency. Dealing with the rest we can manage, but I wouldn't stop that especially if it's a medical emergency and we need to get to, take the blood pressure for whatever reason.
Mm-hmm. And that's the same with like the blood work?
So blood work is the same. Try to use just the unaffected limb.
Mm-hmm.
Okay. And again, if it's God forbid, a trauma or something where you're in danger, your life is in danger, and they need to take out blood, then let them just save your life first, and then the rest we can manage.
Perfect. Kathy, back to you.
Yeah, so back to the same thing. What happens if somebody is in a sudden, accident or something, and they arrive at the hospital and, they're not wearing a medical alert bracelet saying I have, had surgery. I guess there's nothing you can do about that, right?
So for us, the first rule is, you have to save that patient's life, right? So if there's a big trauma and there's a huge trauma team that's trying to take care of you, let them do their job. First thing is to manage and stabilize you from a trauma. And then everything else secondary, we will manage. But we wouldn't stop a trauma team from intervening if it's going to save that person's life. So in medicine, we always go back to what the priority is in terms of saving the person's life.
Right. Okay, I'm going to continue with the pre-submitted questions. This one reads, I am a type 2 diabetic. Is fingertip blood glucose testing advisable or a risk if I have lymphedema?
So it's similar to the, drawing blood or the BP cuff. Again, if you have a sound side, I would encourage you to take it from the sound side. Again, if there's a medical emergency and you have to take it, on the affected limb, then take it on the affected limb, right? But, day to day, if this is something that obviously you have to do, then I would just try to stick with the unaffected limb.
Okay. And the next question again is something around when is the right time to go to a specialist and how do they find a lymphedema specialist? So you touched a bit about that, and but when is the right time? Like, do you think some women delay it too much? And I guess we need to empower them and actually teach them how to advocate for themselves and understand when to actually go, because you said something to the effect that some women are afraid to ask, or just, when how do we help women that are doing this?
Definitely. Sure. So right away, if the woman complains that she feels heaviness in her arm, or if there's visual swelling that she notices that her, right side is bigger than her left side, then that's a discussion to have with the oncologist, and the oncologist should make a referral to the lymphedema therapist. So you don't want to wait too long, because the earlier we can kind of catch it, then the risk reduction kicks in, and we can manage it with a garment and everything else that I've discussed. But it's not something that I would be embarrassed about, because if you wait long and it worsens, then it becomes harder to manage. So if you're more comfortable speaking to your oncology nurse, then speak to your oncology nurse, right? Find someone that you're comfortable speaking with. This is nothing to be embarrassed about, but we know that 1 in 5 women will develop breast cancer related lymphedema. So it's common enough that we are aware of it, and that your oncology team should be able to help you.
It is common enough that you're aware of it, that we're aware of it, but I don't know how the general population knows about it that well, if they do know about it that well. I think even in the, researchers, sometimes they don't know. They're studying cancer and they're studying how to, find a cure, but often you hear lymphedema, like it's not something that is widely discussed. So we have to also be mindful of that it's not a big, because I guess it's like you said, it's not life-threatening. So it's not something that is, spoken about that freely and that much.
Right, exactly. So you're absolutely right about saying that. Unfortunately, there's a lot of education that still needs to be done, to get everyone's eyes trained to pick up on this, right? And so, sometimes clinicians, if we miss things and we don't ask the right questions, right? And some women are just afraid to say something, or they're not sure if this is normal or not, right? And so there's a lot of different factors as to why we might miss the lymphedema, or, we've encountered people who just have never heard about this because it's not something that we're trained, unfortunately, in physio school or in medical school. They rarely get any education on the lymphatic system. So there's still a lot of work to be done. I'm 100% in agreement with that. We do our best. One patient, you teach one patient, they're going to teach their, the person sitting next to them in the waiting room, and so on and so forth. It takes a whole village to really educate people, and it comes from webinars like this. It comes from patients asking questions. Women are getting very smart, and I love it. I think it's great that we have the internet, and they can kind of, sometimes do a quick search of their symptoms, and it's scary sometimes what comes up on Google, but eventually they come across something and say, oh, hey, is it lymphedema? Do I have this? Is this something that I need to ask my doctor about? And so, it's important to ask the right questions and not be afraid to speak up in terms if you feel something is off.
Yeah. And I think that would be the same where people are misunderstanding that there is a cure for this, or you can cure this. And that often is, I hear that a lot, where say, oh, well, I can do something to cure this, but that's also something that is misunderstood, and that we need to continue educating patients
Exactly.
and
Exactly. I'm so sorry. I'm going to plug in my computer because it just dunged that I'm going to run on my battery. Give me 1 second here so I can continue. Sorry about that.
No problem.
Forgot to plug it in earlier. I apologize. So yes, because there is no cure to date, the management component is very important.
Yeah.
And so, you know, it breaks my heart to see women who don't get that proper education, and then they come in, you know, 3-4 years later and their arm is completely out of control and they can't carry their kids, or they can't play with their children, or they can't make a meal, or they can't go back to work. And this could have all been prevented if we had caught it a little bit early, right? And so it's the quality of life, which is very, very important after breast cancer treatment. And this is something that we should all be striving for, to make sure that their quality of life is improved after treatment.
Yeah, and I think that we have to be mindful of making sure that these leaflets or this information about possible lymphedema and what happens and how does this occur and what to do and not to do should be a standard, you know, information given to a patient even before they have their surgery or at their surgery. Say, listen, you're going to have surgery, and you know, these are the possible consequences, and one of it can be lymphedema. So I wonder how many women get that from the get-go so that they can retain that information if something should happen. So we need to keep working on this.
We do. There's still a lot of work to be done. And unfortunately, a lot of them don't get that pre-op education. And so
Right.
that's where we end up seeing these cases that have kind of, you know, progressed, because it's not their fault. It's just because they didn't get into the proper, you know, therapist's hands,
Right.
essentially.
Right. Would you say that the cancer centers in general are on top of this?
I think everyone's trying their best in a very, you know, overworked healthcare system.
Okay.
We're all trying our best. And so I think some centers, because they're oncology, you know, centers, they have, you know, more trained professionals than I would say the community hospitals that may not necessarily have the specialty that the bigger hospitals have. But for sure, everyone's trying their best. I think it's just there's a lot still that has to be done to make it mandatory. So for example, you know, in a perfect world, we would have all our women come in and do pre-op education session where we lay it out. You know, this is what you're going to expect after surgery. This is, you know, little tricks that will help you after a lumpectomy or mastectomy. Here's a brochure, you know, in case there's something called lymphedema. What is lymphedema? Who do you contact if you notice this? Like I said, in a perfect world, all our women would go through this pre-op education, but unfortunately, we don't have this set up yet.
Right. I'm going to ask one more question, then I'll turn it over to Bakun. The question is around wound care with lymphedema. So what should you do if you have lymphedema and experience, let's say, a knife cut or a burn in that area? Is there anything that should be done?
Yep.
And is, you know, that would prevent something worse to happen to you?
Sure. So it goes back to the skincare pillar. So managing, if there's a small cut, just cleaning it really well with an antiseptic. What you don't want is that if there is a real open wound and you leave it without addressing it with a wound care nurse, that can become very problematic. But if it's a small scrape, so, you know, sometimes I have a patient who says, you know, my cat scratched me and I got you know, it got turned red a little bit, but they cleaned it. Everything was fine after a few days. That's fantastic, because the whole purpose is to try to minimize the risk of infection, right? So a small little cut is very different than an actual wound. And so if it turns into a wound, then definitely we need to address, you know, we need to work with a wound care nurse to make sure that we manage that well. If there is signs and symptoms of an infection, so what I refer to as cellulitis from before, that is actually a medical emergency. And so we do encourage our women to go to the ER and explain to them that, you know, I have lymphedema, I think I have an infection, so that the healthcare professional can evaluate and then triage accordingly in case they need IV antibiotics. But that is definitely considered an emergency.
Right. Bakun?
Yeah. So you've talked about like needing a prescription, for example, to be able to get compression sleeves. But before you even get to that point, do you need a referral from an oncologist to actually see a lymphedema therapist? Like, can you just go and find one yourself and do all of that? Or do you first need to be entered into the system?
So it depends on the lymphedema therapist. So for example, I'm a physio, that's my background. I can see a patient without a doctor's prescription. Now, if a patient has private insurance, they need a doctor's prescription, or else the insurance companies don't reimburse. So that's where it can get a bit complicated. But let's say we don't have the insurance problem. I can see a patient without a doctor's referral. Now, as a clinician, it's with all the training that we have, it's important for me to realize that, again, I'm not the one making the diagnosis. I've become better at it because of the expertise and knowledge that we've gained. But if I do suspect that there is lymphedema, then I would work with a doctor, like whether it's the family doctor or the oncologist. Oftentimes I collaborate and I help them, in terms of what compression garment is needed. So let's say this is a compression sleeve, what class is good for this woman? And the doctors are great. They're very receptive and say, you know what, it's fantastic. Let's collaborate. You tell me, what prescription to write, and it's a team effort, right?
Mm-hmm.
But there is always a dialogue between the lymphedema therapist and the medical doctor. That's very, very important.
Yeah.
So if the lymphedema therapist is not a physio, then most likely they will need at least the confirmation that they have lymphedema as a diagnosis.
So this person's wondering if people who've been diagnosed with lymphedema have a higher risk of carpal tunnel syndrome.
Not necessarily. No, we don't have any research saying that lymphedema will increase the risk of carpal tunnel. No.
Okay.
I think that's due to all of the typing and the texting and all the stuff that we're on the computers all day long. I would probably blame that a little bit more than the lymphedema.
Is there anything that can cause is there anything that could be, happening to you because of lymphedema? Like not carpal tunnel, obviously you said no, but are there any things that could come up?
So I would say it's more the shoulder
Oh.
issues. So because the limb can get heavy, it's a lot sometimes on the shoulder, right? And so the goal is to try to reduce that volume to basically put less pressure on the shoulder. And that's why the strengthening is important, because you want to make sure that the range of motion of the shoulder is good, and you want to try to get a little bit more strength through the shoulder. You can appreciate how it can be very, very heavy to carry all this extra weight, and it's that poor shoulder that takes that burden, right?
Mhm.
So I would say it's more of the musculoskeletal type of problems that we typically see, from normal sports injuries that can happen, but the reason is a bit different. In this case, it's because of the lymphedema, because of decreased mobility or whatever the case is, that's leading to this.
Okay. So breast cancer is more often diagnosed in women, and so we've been talking about like women having to deal with this. But someone's curious if men also get breast cancer related lymphedema. Like, do they have I guess they would have also like their lymph nodes removed if they are diagnosed with breast cancer and as a treatment for breast surgery. So are you able to speak a little bit more on that? Does it look the same? Does it present the same in men as in women, or is there any differences?
Yes, so that's a good point. Yes, men can develop breast cancer. I think people think that it's impossible, but it's not. It's obviously less likely than women. It would present the same, right? Because it's lymphedema is lymphedema, and it's the mechanism of trauma that will cause the lymphedema. And so, like I said, it's not just breast cancer that can lead to lymphedema. We see it in prostate cancer. They can get it in their legs. We can see it in head and neck, post head and neck treatment. There's a long list of tumor sites that we know that can lead to the lymphedema because of the management. And so it wouldn't be any different for a man versus a woman. But generally, I think men who are diagnosed with breast cancer have a much harder time going through the system, just because it's so taboo to walk around and say I'm a male and I have breast cancer, right? It's not a common thing. And so, it's still important to give them the appropriate care. They deserve it just like all our women. So we would treat them the exact same way with the compression and all the other pillars that I mentioned before.
Yeah.
Someone's wondering, when reconstruction in breast cancer and an insert is completed, could this aggravate the lymph nodes?
So the reconstruction after surgery, it is further sort of trauma to the area. It doesn't necessarily mean that it will worsen the lymphedema, but it can impact the lymphatic system. And again, this is more case by case. I don't want to make a general statement, but it can potentially impact the lymphatic system a little bit, depending on, the tissue as well that was irradiated. Is the tissue, back to sort of normal, or is there still a lot of fibrosis from the radiation? So it's a bit more complicated than just placing in the implant. It's really the integrity of the skin after, the surgery, the first surgery, and what it looks like.
Mhm. Okay. And then this last one here. So this person has had lymphedema since 2008. They're wondering how important wearing a compression sleeve is every day. They haven't been wearing it every day, but they've been careful in other ways. And they've been referred recently to a physio to have it checked out. But I guess if with the pillars, if you're combining other things, like you don't necessarily need to wear your compression sleeves every day.
I think that to answer that, I would be interested in seeing the volume of the limb. So if the percentage difference, for example, between the two sides is, 3%, then yeah, maybe you don't need to wear it every day. But if the volume difference, like say the affected versus unaffected is, 80% bigger than the sound side, I would say that, why has it gotten to 80? Is it because we're not wearing the compression, and can we do better, right? So we come from a perspective of, we try to minimize that volume as much as possible so that it doesn't progress. It's hard to comment specifically on this case because this person can have very little difference between the two, and they're using all the other pillars and it's working beautifully for them, and that's fantastic. But that may not be the case for others, right? And so it really is independent it depends on the patient, really.
For sure. Okay, I'm just going to combine these last two questions just because they're from the same person, and then we'll go back to Kathy to end this off. So we've spoken about research articles, and we said that there's not really any articles that say like, okay, this pillar is better than the other, but is there any research articles at all on lymphedema management? Like even if it talks about the combination of them or one of them, like is there a place where people can find these types of research articles? And then their second question is if they're wondering if you're able to share your contact information if they have more questions in the future.
Sure. So there's constant research articles that come out. I mean, I try to get sort of scholarly alerts all the time, and there's always new research coming out. Now, is one superior than the other? I mean, that's always the magical question. To date, we can't say that one is more superior, but we know that in terms of, we can kind of prioritize, perhaps that might help patients a bit better. We know that weight management is a big one. And so this is a very difficult topic to discuss in general, but the heavier the woman is, the harder it is on the lymphatic system. Therefore, it's harder to manage the lymphedema. And so, going back to just exercise and eating healthy, that's really important. And that makes a huge difference. So for example, when women lose, like, let's say 10 pounds, we can see it. We can actually see it in their volume, and they feel better and they're lighter because it's not just the lymphatic fluid now, it's also the weight, this extra weight that they have to carry. I would say, the compression is important. If you need to wear compression and it's been recommended, then I would say please use it, because again, that's one way to minimize the volume from getting, from worsening.
Mhm.
Movement. So, doing a little bit every day. You do not need to join a gym. You do not need to do anything wild. I'm a physio. I do not go to the gym 5 days a week. I do not even have a gym membership. I will admit I'm a swimmer, so you'll find me in the swimming pool more than you'll find me outside, but that's just because I love swimming. So I find something that I enjoy doing and I do it. I make an effort to do it. That doesn't necessarily mean you need to become a swimmer, right? But you need to find something that you enjoy. So whether it's walking your dog or, whatever it is, you pick and do a little bit every day, because that makes a big, big difference on the lymphatic system. And it just helps in general. It makes you feel good after you've moved a little bit, right?
Mhm.
And so those, I would say, are probably the top priority. And then, the skin management. So trying not to, do anything too crazy with your skin, protect it, use your creams, use your oils. You don't want to create cellulitis in the area. So I would say if those were sort of my priority list, I would put them in that order.
Perfect.
Well,
Um,
Marize, that's an excellent way to end this, because I was going to ask you to give you your top, your priorities, etc., and you just did this beautifully. So
Perfect.
unfortunately, this brings our session to a close. This was a very successful session. Thank you to everybody for their excellent questions and for joining us. Thank you, Marize, for a great and, engaging discussion. I'm sure we had a lot of takeaways from your information. And thank you again to our participants for attending and all the great questions that you've asked. After this session, you will be sent a survey to provide feedback on this session. Please fill it out. And please fill out the survey, as your responses will help us make these sessions better. Once again, I'd like to give a big thank you to our sponsors, Novartis, Pfizer, Viatris, AstraZeneca, and Roche, who made this session possible. Thank you, everyone. Have a great day. Bye.
Thank you very much. Thank you. Have a great evening, everyone.
Right.